In this case study, we have a patient coming in, and within a week, we see significant results, and we'll talk about it and understand how Chinese herbs are good for reducing inflammation and also moisturizing the body and the skin from within. This is opposed to the wet eczema that we talk about in other videos. I'll show you 3 body parts with 3 different types of eczema, 1 on the elbow and 2 on the left leg. Let's start with the leg. This is the leg. You see scratch marks. He has scratched it so much that the whole leg has turned white on the skin. This is usually where the whole idea of moisturizing the skin topically is going to be useful. This is because the skin is dry and moisturizer helps to undry the dry skin. When skin is as dry as in this patient's, it is called Xerotic eczema. It basically means dry eczema. So use your moisturizers in these situations. But don't forget that we can use Chinese herbs to moisturize and lubricate from within. This is something that a dermatologist cannot do. You can of course use steroids to reduce inflammation, whether from oral steroids or from topical steroids. Or you could use antihistamines. But what Chinese medicine can do really well is to moisturize your body from within. This internal moisturizing effect is most important when you are in your 40s and beyond, because as we get older, we dry up. Women will relate to that, but not just women, men also. This is also relevant to people who are smokers, because smoking dries you up. This is his elbow. You can see exaggerated lines on thickened skin. Such a presentation qualifies as lichen simplex or neural dermatitis. Oftentimes, we see patients coming in for lichen simplex and they're saying, hey, I have this thing at the back of my neck. It's very itchy, and when I go look at it, it looks like this. It's this leathery skin with these tic-tac-toe crossing lines. And that is lichen simplex. It's usually this one stubborn patch that you keep scratching and it keeps getting more leathery and thick. But what's most characteristic of lichen simplex is the tic-tac-toe lines. The usual treatment principle for lichen simplex is to reduce inflammation and to stop the itch. What's nice about Chinese medicine is that, of course, we bring down inflammation, and by bringing down inflammation, we can reduce itch. What's really special when we treat a lichen simplex patient is that because there is a lot of itch, we use Chinese herbs like these to extinguish wind. Wind is equivalent to itch in Chinese medicine, so we want to extinguish wind. But also, we're able to moisturize from within because lichen simplex lesions are usually very dry. Okay, the third body part. Let's go back to the leg. You can see in the upper shin, there is this fine adherent plate-like scale. But you can see it's shiny, so it's dry and shiny, and it's very different than what's lower down, which is dry and scratchy and definitely not shiny. This kind of presentation is not itchy at all. It just feels dry. This is an Ichthyosiform presentation. This kind of presentation relates to this label called Ichthyosis vulgaris. In this situation, and some of you might have it, there are different parts of the body where you see these shiny, scaly skin. It's not overly irritating, but these people have it all the way from childhood usually. When it appears when you're an adult, we don't call you Ichthyosiform vulgaris. We just say you have that kind of a presentation, and that is usually due to dryness. Now, this is where we talk about why there is a dryness, and you have probably heard of this elsewhere. A lot of patients with atopic dermatitis have a mutation in the FLG gene. You've probably heard of this. And this mutation causes the skin to be dry. And because the skin is dry, there is a barrier dysfunction, and therefore the skin gets compromised and they get eczema. In such a situation, the claims made by moisturizing creams are all very appropriate. They protect the skin barrier using ceramides, hyaluronic acid, other good lipids, and they are good for a dry skin situation. But Moisturize should not be a blanket solution applied to all forms of eczema. Yes, you can say that a lot of atopic dermatitis and eczema is due to mutations in the FLG gene, which leads to reduced production of filaggrin, which then leads to dry skin and compromised barrier. But it doesn't apply to every kind of eczema. For example, look at these types of eczema. They are wet and weepy. Moisturizers may even aggravate such situations. What is more helpful is calming down and reducing the inflammation. Moisturizers and repairing of skin barrier would be more appropriate, of course, as the skin heals. This is where it's more appropriate to recover barrier function for your skin. Anyway, back to my patient. Within 5 days of using Chinese herbs, his skin has improved from this, and this within 5 days. He reported that the skin was much better and less scaly. So we continued with 3 more days of herbs. And you can see less white scratch marks, less adherent scale, and the elbow is slightly better. This is because Chinese herbs are able to nourish and moisturize from within. They're able to extinguish wind, which is itch, and overall they're able to bring down inflammation. Of course, you still have to manage your stress levels because stress aggravates inflammation. So thank you for listening, and next, watch this video on viscoid eczema, which is a wet or damp type of eczema, which is very different for dry eczema where you use moisturizers a lot. Thank you.